Welcome to the role of occupational therapy in home care, Part 2. Here are some examples of items I have adapted to make my clients' daily occupations easier and safer. Wheeled laundry basket with a handle that I then added 2 caster wheels in the front so it could be attached to the back of a power wheelchair of a client with cerebral palsy to make taking his laundry across the street a much safer and easier task as compared to placing his large laundry bag in his manual wheelchair and pushing the wheelchair one-handed across uneven surfaces with a very unsteady gait. This is an example of a pair of adapted pants I made for a client who recently suffered from a stroke and is now dependent for lower body dressing and toileting at bed level. I do not have a picture of an exact pair of pants I made for my client. However, I designed my pants after the picture shown to make peri-care and toileting an easier task for the client and his caregiver. With these pants, the caregiver is able to quickly remove the clothing to complete toileting tasks with increased urinary urgency. Occupational therapists can also play a role in palliative care and hospice treatments. The goal of palliative care includes providing pain relief and symptom management, offering support systems to clients and their families, and integrating psychological and spiritual aspects of care with the necessary medical treatments. Occupational therapists play an important role on palliative and hospice care teams by identifying life roles and activities or occupations that are meaningful to clients and addressing barriers to performing these activities. They also help prevent contractures and maintain joint integrity with stretching routines or splints that don't interfere with daily activities. In these settings, a less aggressive, client-centered approach is taken to improve our clients' overall quality of life. The occupational therapy process begins with collaboration with the start of care nurse on the OASIS once our assessment is done to allow better patient outcomes. We work as an interdisciplinary team including nursing, physical therapy, occupational therapy, social work, home health aide, and speech. Home care services typically run on a 60-day period with reassessment on or before 30 days, with collaboration with the doctor for start of care and discharge. The therapy process comes to an end after the client reaches their optimal level or planned therapy goals. The client will then typically stay at home with a home exercise program and appropriate level of care, or go on to an outpatient services once discharged from home services. I hope you enjoyed this presentation and have learned more about the role of occupational therapy in the home care setting.